Today we're going to talk about sexually transmitted diseases. Sexually transmitted disease is an infection that can be passed from one person to another through sexual contact with an infected partner. It can be transmitted via direct skin-to-skin contact through vaginal sex, oral sex, anal sex, or from an infected mother to child. Prevention, recognition, and treatment of sexually transmitted diseases are important. First, it is very common. The Centers of Disease Control and Prevention estimates that there are approximately 20 million new STD infections each year, almost half of them being young people between ages 15 to 24. Second, most of the infected people do not have any symptoms of STD. Third, most of the infected people are unaware of infection. Fourth, STDs cause long-term damage such as pelvic infection, infertility, fetal health damage, and cervical penile cancers. All sexually active people are at risk for STDs. STDs affect people of all races, ages, and sexual orientations. Communication is important to prevent transmission of STDs. Talk with your partner or partners prior to sexual activity about ways to protect yourself against STDs. Chlamydia infection. It is the most common reported STD. Total cases reported in the U.S. in 2017 is 1,710,000. Most of the reported cases in 2017 were females, which is the 66% of the total cases, and the 34% of them are males. It is known as silent disease because there aren't any symptoms of chlamydia. Common symptoms of chlamydia are a smelly abnormal discharge of genitalia, a burning sensation when urinating, pain and swelling in one or both testicles, bleeding between periods or after sex. Gonorrhea infection. It is the second most common reported STD in U.S. There were approximately 500,000 new cases in 2017 in U.S. Symptoms are the same as chlamydia, only difference is that it also can cause throat infection, which can present with persistent sore throat. Both chlamydia and gonorrhea infection causes serious complications such as infertility, ectopic pregnancy. It can also be transmitted to fetus and newborn, cause congenital damage and eye infection and lung infection. For women, untreated chlamydia can spread to uterus and fallopian tubes, which are the tubes that carry fertilized eggs from the ovaries to the uterus, causing pelvic inflammatory disease. Men and women can also get infected with chlamydia in their rectum, either by having receptive anal sex or by spread from another infected site such as the vagina, which can cause rectal pain, discharge, and rectal bleeding. Trichomoniasis, which is also known as Trich, is caused by a parasite called Trichomonas vaginalis. Symptoms are the same as other STDs. Most distinguished symptom is a green vaginal discharge, and it can cause premature birth and low birth weight in pregnant women. How do you know if you have chlamydia, gonorrhea, or trich? Symptoms show up between 1 to 3 weeks after the transmission of infection. You need to make an appointment with your doctor to get a pelvic exam. Women usually get vaginal swab and men get urine test. It is absolutely necessary to inform the partner or all partners if you get a positive test for STD. Test of cure will be done about 3 months after you are treated. You should not have sex again until you and your sex partner or partners have completed treatment. You should wait 7 days after taking the medicine before having sex again. Herpes infection. It is caused by a virus called Herpes simplex virus. There are 2 types of herpes simplex virus. HSV1 causes oral herpes infection. HSV2 causes genital herpes infection. It causes painful blister. Genital herpes is common in the U.S. More than 1 out of every 6 people between the ages 14 to 49 years have genital herpes. Oral herpes is usually caused by HSV1 and can result in cold sores or fever blisters on or around the mouth. Most people with oral herpes get it from non-sexual contact with saliva, but it can also be spread from the mouth to the genitals through oral sex. How can you reduce your risk of getting herpes? Abstinence of sex, have a single partner, use latex condoms the right way. Herpes sores generally occur in areas that are covered by a latex condom. However, it could shed from areas of the skin that do not have a visible herpes sore. For these reasons, condoms may not fully protect you from getting herpes. Hand washing, and if you touch your sores or the fluids from the sores, you may transfer herpes to another part of your body, such as your eyes. Do not touch the sores or fluids to avoid spreading herpes to another part of your body. Pregnancy and herpes. It can pass to the infant during delivery. This can lead to a potentially deadly infection in baby called neonatal herpes. Anti-herpes medicine reduces your risk of having genital herpes at the time of delivery. Anti-herpes medicine is given at 36 weeks till delivery. At the time of delivery, your doctor should carefully examine you for herpes sores. If you have herpes symptoms at delivery, a C-section is performed. Treatment. There is no cure for this disease. Medicines can prevent or shorten outbreaks. HPV. Most sexually active men and women will get at least one type of HPV at some point in their lives. HPV transmission is the same as other STDs. The chances to get infection from skin-to-skin contact is high. Even virgin people can get infection from skin-to-skin rubbing. HPV is important as there are many different types of HPV. They can cause genital wart and cancers such as cervix, vulva, vagina, penis, and anus. The types of HPV that can cause genital warts are not the same as the types of HPV that can cause cancers. Genital warts usually appear as a small bump or a group of bumps in the genital area. They can be small or large, raised or flat, or shaped like a cauliflower. HPV is number one cause of cervical, anal, and penile cancers. Cancer often takes years and even decades to develop after a person gets HPV. There is no way to know which people who have HPV will develop cancer or other health problems. People with weak immune systems, including individuals with HIV and AIDS, may be less able to fight off HPV and more likely to develop health problems from it. There is no test to find out HPV status of a person. It is usually known if a patient gets screening for a cervical cancer or genital warts. Treatment of HPV. There is no treatment for the virus itself, but there are treatments for health problems it can cause, such as surgical removal, cryotherapy, freezing of lesions. In most cases, the immune system will overcome HPV on its own. You can reduce your risk of HPV infection. Number 1, get vaccination. CDC recommends that 11 to 12-year-olds who receive 2 doses of HPV vaccine at least 6 months apart will protect them against cancers caused by HPV. Catch-up vaccination is recommended for adolescents and adults aged 13 to 26 years who have not been previously vaccinated or who have not completed the vaccine series. HPV vaccination works extremely well. Clinical trials showed the vaccines provided close to 100% protection against precancers. If your doctor does not stock HPV vaccine, ask for a referral. If you don't have a regular source of healthcare, federally funded health centers can provide services. Number 2, get cervical cancer screening. Routine screening with Pap smear is recommended for women aged between 21 to 65 years old. Syphilis. Syphilis is an STD that can have very serious complications when left untreated, but it is simple to cure with the right treatment. The infection is treatable with antibiotics but may have serious health consequences such as weight loss, rash, and permanent damage to internal organs if left untreated. Pregnant women with syphilis have a chance of delivering stillbirths depending on how long she has been infected. Symptoms of syphilis vary among the different stages of disease. Many people do not have any symptoms for years, yet remain at risk for complications if left untreated. Primary syphilis. Primary syphilis generally has a sore or sores at the original site of infection, which appears within 2 to 4 weeks of exposure. These sores are called chancre and usually occur on or around the genitals or around the mouth. These sores are usually firm, round, and painless. Chancre disappears after a few weeks if left untreated. Secondary syphilis. Symptoms appear about 4 weeks after chancre heals. It can cause non-itchy rash with rough red or reddish-brown spots on palms and soles, hair loss, white mucus patches on mouth, vagina, and anus, and condylomata lata or fleshy warts or anogenital region. Symptoms will go away without treatment, but infection will progress. Latent syphilis. During the latent stage, there are no signs or symptoms, but syphilis is still present in the body. If left untreated, a patient can continue to have syphilis in his or her body for years without any signs or symptoms. Late or tertiary syphilis. At this stage of disease, damages your internal organs and can result in death. It affects heart and vessels and causes heart murmur and heart failure. It affects brain and spinal cord and causes paralysis. It affects eyes and causes blindness. It affects ears and causes deafness. It affects bones and causes destruction of tissue. It also causes mental disorders such as dementia. Most people with untreated syphilis do not develop late-stage syphilis because of the widespread use of antibiotics. However, when it does happen, it is very serious and would occur 10 to 30 years after your infection began. Congenital syphilis. It causes prematurity of fetus, birth defects, Hutchinson's teeth, osteochondritis, and developmental delays. 30% of fetuses with congenital syphilis will be stillborn or die in the hospital. HIV and AIDS. HIV, the letter H stands for human. HIV is a retrovirus, meaning it cannot reproduce outside of the human body. To cause infection, HIV must be able to reproduce and survive. I is for immunodeficiency. This refers to an unhealthy immune system, which is the body's natural defense against rare infections and diseases. V is for virus. There are viruses that enter the body, stay for a while, then eventually go away, like cold or flu viruses. However, HIV does not go away. There is a treatment, but no cure. HIV is the virus that causes AIDS, acquired immune deficiency syndrome. HIV attacks the immune system, which protects the body from infection. This is why it is so dangerous. AIDS is a late stage of the HIV infection. Once diagnosed, the body has a hard time fighting disease and certain cancers. There is no cure for AIDS, but there is treatment to control the disease. In 2016, there were 38,000 people diagnosed with HIV in the US and 17,000 people diagnosed with AIDS. More than 1 million people in the United States are living with HIV infection. Among all those living with HIV, 1 in 8 are unaware of their infection and can unknowingly pass the virus on to the others. About 1 in 4 newly HIV infection is among youth aged. How does HIV spread? It spreads from person to person through the exchange of bodily fluids. 1. Unprotected sexual contact with people living with HIV. 2. Blood-to-blood contact. Blood-to-blood contact occurs with sharing needles when shooting up a drug like heroin. Transmission can also occur with works, the spoon, bucket of water, and cotton ball that is used while injecting and sharing drugs. 3. Exposure to HIV before or during birth. Mother to child transmission of HIV is the spread of HIV from an HIV infected woman to her child during pregnancy, childbirth, or breastfeeding. It is the most common way that children become infected with HIV. 4. Through breastfeeding. Because HIV can be transmitted in breast milk, women with HIV living should not breastfeed their babies. Baby formula is a safe and healthy alternative to breast milk. Pre-exposure treatment of HIV prevention. Pre-exposure prophylaxis is the daily medicine that can stop HIV from replicating inside the body. It reduces HIV transmission 90% from sex contact. PrEP is only prescribed for HIV-negative individuals who are at ongoing substantial risk of getting HIV. Substantial risk means having an HIV-positive partner, having a high number of sex partners, had a recent bacterial STD, history of inconsistent condom use, known to share needles or works. How can a person reduce risk of getting STD? There is no risk with abstinence, not to be sexually active, or genital contact in long-term mutual monogamy. There is reduced risk with protected sex, using condoms in the right way with each sexual intercourse, regular testing, never sharing needles or works, and pre-exposure prophylaxis. Protected sexual intercourse. Proper use of male condoms. Do's. Do you use a condom every time you have sex? Do you put a condom before having sex? Read the package and check the expiration date. Make sure there are no tears or defects. Store condoms in cool and dry places. Use latex or polyurethane condoms. Use water-based or silicone-based lubricant to prevent breakage. Don'ts. Don't store condoms in your wallet as heat and friction can damage them. Don't use a spermicide as this can cause irritation. Don't use oil-based products like baby oil or cooking oil because they will cause the condom to break. Don't use more than one condom at a time. Don't reuse a condom. Wrong beliefs about STDs. Can you get herpes or chlamydia from the toilet seat? STDs cannot be passed from a toilet seat. Even if the bacteria and viruses that can cause an STD got onto the seat, they cannot survive for long after leaving the human body. Most organisms do not last any more than a few minutes because they dry out and die. Where to get tested for STD? You can get tested at community-based organizations, local health departments, at your primary care provider or gynecologist urologist office. You can check out these apps and websites to find more information in closer testing places. These websites were used for preparation of this presentation. Thank you for listening.